Hello.
Hello, hello. Good morning.
Good morning. Hello. Hello.
No. Can you hear us? No.
Hello, hello, hello. 1, 2, 3.
Hello. Good morning, everybody. Good morning and welcome. Hello. Good morning, everybody. Good morning and welcome. We have a very full house, and I was just going to address people at the back who are standing. The talks and all the activities here will be shown live in the first 3 rooms out there, so if you want to move and be more comfortable, you're very welcome. Otherwise, stay standing. Thank you.
Welcome to Sweden, everyone, and welcome to AIDSImpact 2023. I'm Patrick Furtebaus, Chairman of Posithiva Gruppen, the local host of this conference. Posithiva Gruppen is a national organization for people living with HIV in Sweden, and it was founded in 1985. In this video, you will meet a few of the NGOs working in the HIV field in Sweden.
Hello, all delegates at AIDSImpact. Welcome to Sweden. My name is Peter, and I'm the chairman of Posithiva Gruppen Norr. And it's the only patient-organized group for people living with HIV in the northern part of Sweden. And by northern part, I actually mean more than half of Sweden. Have a nice day in Stockholm.
Läkare i världen is a non-profit organization and part of the international network Médecins du Monde. We advocate for care based on needs for everyone. At our clinics around Sweden, we give care to migrants who lack access to healthcare. We work with HIV prevention and we offer HIV rapid tests.
Since the mid-80s, Noaxarc is committed to the prevention of HIV and other bloodborne and sexual transmittable infections. We raise awareness and seek to reduce the vulnerability of people living with HIV. Noaxarc is an NGO in Sweden, and you're more than welcome to visit our helpline and support services around the country. Our website is noaxarc.org.
Hello, we are Posithiva Gruppen West, by and for people living with HIV. We are focused on peer support and rights, and based in western part of Sweden. We are happy to be part of AIDSImpact 2023. Bye!
Hej från Noaxarc, Göteborg och Västra Götaland. Vi arbetar med HIV-prevention och för din sexuella hälsa.
Hej från oss på Convictus uppsöksverksamhet för sjukvård och smittskydd.
Hi, my name is Peter Sidlund Ponkala and I am the acting president of RFSL. RFSL is one of the oldest HIV and STD preventive organizations in Sweden, and we organize members and activities in the entire country. from Malmö in the south to Kiruna in the north.
Hej och välkomna! Vi är Joost
and Anton, and we are working at Posithiva Gruppen Syd, founded in 1987 and based in Malmö.
We cover the south of Sweden and are passionate about helping people living with HIV.
We focus on peer navigation, social activities and awareness campaign to reduce stigma.
Have an inspiring conference.
We at the HIV NGO of Noaks Ark Stockholm would like to greet you all at the conference. A very warm
Bienvenue.
Välkommen.
Karibuni.
Ahlan wa sahlan.
Bienvenidos.
Welcome.
So, do you hear me? Yeah, okay. So, good morning, everyone. My name is Lena Nilsson Schönnesson, and I'm the chair of the AIDSImpact Conference 2023. Next to me here on the podium is Daniel Suarez and José Catalán, and they will introduce themselves eventually. On behalf of the Swedish Local Board and the AIDSImpact International Board, I want to sincerely welcome you all to Stockholm, the city between the bridges, the Venice of the North. To paraphrase Martin Luther King, I had a dream to bring the AIDSImpact Conference to Stockholm for many, many years. And now my dream has come true. So to all of you, do feel most welcome to the 15th AIDSImpact Conference. And now I would like to hand over the floor to Daniel Suarez.
Thank you, Lina. My name is Daniel Suarez, and I'm the operations manager at Posithiva Gruppen, a co-chair of the local board. I'm delighted to welcome Desiree Ljungcrantz and Galit Andersson from the Public Health Agency of Sweden to the floor. Welcome.
What a crowd. So my name is Desiree Ljungcrantz, and on the behalf of the Public Health Agency of Sweden, I would like to really thank you for organizing this important conference here in Stockholm. So thank you, Lena, for your dream. As the head of unit for the Unit for Sexual Health and HIV Prevention at the agency, as a PhD HIV scholar, and as a person living with HIV, I really appreciate the theme, Power for Action Now. Because there are many barriers and many challenges in the society, here in Sweden as well, affecting the life with HIV. And this is aspect studied by the agency, which PhD and analyst Galit Andersson will present. Thank you.
I'm going to try to use the mic here. Thank you, Desiree, for a very nice introduction. And I'm very honored to be one of the first speakers here, and also a bit nervous about being one of the first speakers here. Yes, as Desiree introduced briefly, I'm going to present to you a study that we are conducting at the Public Health Agency of Sweden. The mic is working okay? You can all hear me? Yes. Good. And this study is, I'm going to give you some background about why we conducted the study and some of the results. I'm going to start by saying that we are still, we're at the end process of publishing this report, and we are hoping that this will be published by the end of the week. Otherwise, in the beginning of next week. We were rushing. So some of the background, I'm going to do this so I can see my notes here. Yeah, brief background about why we are conducting this study. So, as many of you here know, and Sweden has very good clinical outcomes or treatment outcomes for people living with HIV. It is estimated that around 99% of nearly 8,500 people living with HIV, with diagnosed HIV, are connected to healthcare, and of these, about 95% are virally suppressed. So, very good clinical outcomes, but we know, as Desiree mentioned briefly in her introduction, that people living with HIV face different types of challenges related to their health in general, to psychosocial health, and a stigma, nevertheless. We needed new updated knowledge about people living with HIV in Sweden. As some of you know, the Public Health Agency of Sweden monitors the the national HIV strategy. One of the strategy's objectives is to minimize HIV-related stigma, and so that people living with HIV can disclose their status without risking being discriminated against. We also wanted to follow up a previous study that was conducted during 2014 about the quality of life of people living with HIV. This was a study conducted by Karolinska Institutet and was assigned by the Public Health Agency of Sweden. And this survey that I'm presenting today is actually a part of a series of different studies that we conducted between 2021, and we are still conducting them during this year. We are employing different methodologies. I'm going to speak a little bit about that later today in one of the sessions. We are employing qualitative methods and survey methods, registries, and diverse methods in order to capture the complexity of living with HIV among different groups and different issues. So briefly about the methods of the survey, we have conducted an online survey. So we used convened sampling. We took a lot of help from civil society organizations, many of those here, both organizing and present, both with giving information about our study in social medias, but also we used some advertisements in different channels. We also advertised about the study with posters that we distributed across the country to clinics, both primary care clinics and infection clinics. And the survey was anonymous. It was developed with collaboration with different NGOs and experts in the field, both in the agency but also in the research field. And our recruitment efforts ended up with nearly 300 respondents. What you can see here is the advertisement banners and posters that we used to recruit participants. So some of the characteristics of participants that responded to the questionnaire, you can see here, the green bars represent the data that we have about people receiving care, people living with HIV receiving care from the InfCare, the qualitative registry that we use in Sweden. And in the purple bars, you can see respondents to the survey according to different characteristics. And as you can see here, that women are quite underrepresented in our sample in comparison to the group of people living with HIV receiving care. Also, people born in Sweden are overrepresented in comparison to people born outside of Sweden. When it comes to different age groups, we see that it's pretty representative. But when we look at route of transmission, we see that the people reporting MSM as route of transmission are also slightly overrepresented in the sample. I will get back to that in our conclusions. But now I will show you some of the results. So one of the main questions that the survey addressed was quality of life and satisfaction with life. And what you can see here on this graph is a scale from 0 to 10 where 0 represents very low quality of life and 10 represents very high quality of life. And this is the distribution of the responses. The green bars are represent the results from a previous study from 2014-15, and the purple bars represent the current study. And as you can see here, it's pretty similar in results, and most participants rate their quality of life somewhere between 7 and 10, which we interpreted as high quality of life. If there are any differences, are perhaps that some of the participants in the current study reported their quality of life quite high up here on the scale, between 9 to 10. And this graph shows the mean scores of quality of life on this scale across different groups of participants. And basically, we didn't see any significant differences between women and men, people born in Sweden and outside of Sweden, and across different age groups. The mean score of quality of life was quite similar. We saw that, except from the questions about quality of life, we also raised different questions relating to life with HIV, both related to mental health, but also to discrimination and stigma. And here we used the HIV stigma scale in order to assess HIV stigma, which is here presented according to 4 different types of stigma. Disclosure concerns is the green bar. Concerns about public attitudes is the purple bar. Negative self-image, or what we often refer to as internalized stigma, is here on the orange bar, and personalized or enacted stigma on the blue bar. And this scale is used... I'm sorry. There we go. This scale goes from 3 to 12, where 3 represents low stigma and 12 represents high stigma. And this is the mean score of each of the stigma scales. And what you can see is that the stigma that was experienced to the largest extent was in regards to disclosure concerns and to concerns about public attitudes, whilst the other types of stigma were experienced to a lower extent, even though they were definitely present. We also addressed issues related, new issues that we haven't explored previously in our studies at the Public Health Agency. We asked about intimate partner violence, and we found that almost every 5th of the participants reported experiences of intimate partner violence. We also asked about the different needs that participants had in regards to their HIV care, but also in regards to psychosocial care and other type of healthcare needs. And we found that most of the needs related to HIV were fulfilled, whilst different types of needs were unfulfilled. For example, the need to talk about one's sex life, the need to contact a psychologist or a counselor, managing loneliness and managing stress. Our study has some limitations, as I mentioned before. The group is not representative to the whole group of people living with HIV. We have some underrepresented groups. And that's why we also conducted different studies at the agency in order to manage this limitation. We need to have more in-depth analysis in order to see whether there are different relationships explaining those differences that I presented here today. What we conclude is that the majority of people living with HIV in this study that we conducted report quite high quality of life and satisfaction with life, but we see that there are still some challenges that many people living with HIV are facing. Among those as HIV stigma and challenges related to mental health. And it's a diverse group with different trajectories and needs, and more attention is needed to be given to mental health issues, sexual health, and experience of intimate partner violence among people living with HIV. Thank you very much, and the report can be hopefully on our website on Friday or Monday next week. Thank you so much.
Hello, I'm Pepe Catalan. I'm one of the founding members of AIDSImpact. Little did we know over 30 years ago that we would still be here after 15 meetings, and perhaps with many more to come, perhaps another 30 years await us. It's not a sign of us being desperate to hang on to it, it's a sign of how the problem continues and changes shape. So I'm sure that within a few more years, 20, 30 years, we will still be struggling. Having said that, I'd like to welcome Tala Al-Kurdi, Healthcare Commissioner for Stockholm. Please.
Well, thank you so much. Dear all, as the Healthcare Commissioner of Stockholm County, I'm very happy to welcome you to Stockholm. I'm glad that we are able to provide you with some good and warm weather, but a word of advice though, we're not that far from the Arctic Circle, so the nights are still cold. I've learned that the theme for this conference is Power for Action Now. I think that's an excellent choice. HIV continues to present a big challenge. It's a fight that has not been won. It's a fight that we can only win together, even though there are unique circumstances in every country and or region. In Stockholm County, we have recently decided to expand access to PrEP to get the waiting times down. And we continue to explore more ways to improve the outreach of our HIV prevention efforts, for instance, among migrants. Every group and community must be included and feel included. While doing that, it's also necessary to raise the level of knowledge. In Sweden, for instance, only 4 out of 10 knows that undetectable equals untransmittable. That's far too few. We can do better. I would again like to thank you all for coming to Stockholm and for your life-saving work around the world. I hope this year's AIDSImpact will be rewarding for you all, and that you will be energized to continue the fight, not only against the virus, but also against prejudice, stigma, and unequal access to healthcare. And a very special thank you to Posithiva Gruppen for co-arranging this conference. You are an inspiration to us all. Thank you.
Thank you very much, Tala. I would now like to welcome Andrea Hedin, Opposition Mayor for Stockholm.
Welcome to Stockholm, and on behalf of the city, we're honored to host this important conference. My name is Andrea Hedin, and I'm Opposition Vice Mayor here in Stockholm. And I want to thank the organizers for inviting me to say a few words. Stockholm is an open, modern city that prides itself as being a hub for innovation and scientific discovery, with top universities and a vibrant life science ecosystem. I wish you a warm welcome to Stockholm. It is my firm belief that scientific advancement and discovery should be communicated, shared to the general public, especially when it comes to matters of health. Without knowledge, there is only ignorance, which fosters taboos and unfair treatment of people. Science and public perception come a long way since the AIDS crisis of the 1980s, but there are still, to this day, discriminating regulations in Sweden that remain based on historical events. Homo and bisexual men are still prohibited from blood donations in Sweden, even though sexual orientation should not have any bearing on the suitability of a blood donor. Canada and several countries have taken the step, and Sweden needs to do the same. Knowledge, education, and preventive work are key elements in the fight against HIV and AIDS. Every year, the Swedish government contributes public funds to the fight against HIV, which is distributed to non-profit organizations, country councils, regions, and municipalities. The preventive work is done through the dissemination of knowledge, testing, and advice. One of my main focuses as an elected official is Stockholm's education system and schools. And to me, it's important that students have access to up-to-date information and an evidence-based curriculum when it comes to sexual health. Whenever someone seeks information, testing or treatment regarding these diseases and conditions, it's important that healthcare workers or school staff actively work to counteract stigma. In Stockholm, a large part of the preventive work against HIV, AIDS, and other transmitted diseases takes place in our youth clinics. It's important that the work spans all ages, as it affects both the young and the older in Stockholm. Sweden, we have free testing and quick test answers at our youth clinics and other testing sites. Care and possible treatment are also free of charge for the patient in Sweden. With these conditions, it's also important that people in connection with become sexually active also test themselves for HIV. But it's also important for those who come here and not have the opportunity to test themselves in their countries, receive information that they can do so here. Many of you are leading the way to a world which is free from HIV, for which I am grateful. The city of Stockholm serves almost 10% of the entire Swedish population with public services, so there weighs a heavy responsibility on our shoulders. I hope we can get back on track to strive for a healthier city. Once again, thank you for having me. I wish you a pleasant conference and enjoy your stay in Stockholm. Thank you.
So now it's a great pleasure to introduce to you Alexandra Arén and Mohammed Youssef Walai, who will address our theme of the conference, Power of Action Now.
My name is Mohammed. I'm 24-year-old and I've been living with HIV since 2017.
And my name is Alexandra, and I've been living with HIV. Okay, sorry. Hello? Yeah. So my name is Alexandra. I am 28 years old and I've been living with HIV since 2018.
It is a great honor for us as HIV activists, but also as professionals working in the HIV field, to be standing here today and welcoming you to Sweden and Stockholm.
Sweden is known as a country that stands up for human rights, being at the forefront when it comes to fighting inequalities. We were one of the first countries in the world to reach the 1990 targets, and today over 95% of people knowing they are HIV HIV positive have undetectable viral loads. Despite Sweden being a role model when it comes to, sorry, I'm nervous. Despite Sweden being a role model in many ways, we do face the same challenges as many other countries. Although the first HIV diagnosis was given to a person in Sweden in 1982, still to this day, we fight and struggle with limited knowledge, not just among the general public, but also among healthcare professionals. People are still being diagnosed far later than necessary because someone thinks they're not considered a risk group. I myself is an example of having had to argue to get an HIV test because the medical staff didn't think I met with the criteria for someone who has HIV. Prejudice and lack of information contribute to people avoiding or being denied getting tested. Despite Sweden having a small population, the country is big and distances are long. And we face challenges when it comes to equal health care for everyone living with HIV, regardless of who you are or where you live.
Since the beginning of the epidemic, a lot has changed, and I'm in many ways grateful to be living with HIV today. I know that 30 years ago I might not have survived, and I'm grateful for all the new knowledge, perspectives, and friends I've gained in the last 5 years. But still, as many of you know, the sky isn't without clouds. I worry about such things as getting older with HIV. What are the consequences of the chronic inflammation or the lifelong medication? How will it affect my health when I'm 90 or even as young as 60? Regarding getting older, I also worry about what will happen when I need assistance or elderly care. Will I be treated with respect or discriminated against because I'm HIV positive? Despite access to treatment and the fact that many people living with HIV in Sweden have a high quality of life, stigma and discrimination remains a challenge. During the 40-year-long epidemic, Sweden has unfortunately placed itself on the top countries when it comes to prosecuting people living with HIV. Still to this day, we have cases in court, including cases where no transmission has occurred. In Sweden, HIV is included in the Communicable Diseases Act. HIV-positive people are required to inform their sexual partners of their infection unless they have an undetectable viral loads and their HIV doctor has removed this obligation. In 2008, UNAIDS published a statement saying that UNAIDS does not support a legal obligation to disclose one's HIV-positive status. We, just like UNAIDS, believe the obligation is stigmatizing and counteracts HIV prevention. We would like Sweden to follow international recommendations and to remove the obligation about one's HIV status for all people living with HIV in Sweden, regardless of viral loads.
Thank you. Working with topics related to pregnancy and parenting, I meet people living with HIV who struggle with both their own worries and that of others when it comes to, regarding safety, when it comes to parenting, pregnancy, and infant feeding. A patient-centered and evidence-based care that allows for shared decision-making as well as a harm reduction approach to issues such as breastfeeding should be a matter of course. In the case of harm reduction, as well as with recommendation, when it comes to removing obligation to disclose one's HIV status, Sweden ignores the recommendations from international organizations such as World Health Organization and UNAIDS.
As you can see, Sweden faces challenges that are both similar to and different from those of many other countries. Therefore, it feels great to be standing here today, knowing we have 3 days ahead of us filled with the latest research, interesting discussion, and a chance to share experiences, knowledge, and different perspectives on the subject of HIV. Power for Action Now is the theme of AIDSImpact 2023. Focus and determination will be required to ensure that HIV continues to feature on the worldwide agenda.
Let's make these upcoming days an event that puts HIV on the public agenda. We thank you all for being here, and we are looking forward to these upcoming days, and we're hoping to make them count. Again, thank you so much.
Thank you so much, Mohammed and Alexandra. And the last item of the opening session is the panel discussion of living with HIV in Sweden. And the discussion will be moderated by Ronja Sannasdotter, the communications manager of Posithiva Gruppen. Please, Ronja, take the floor.
Thank you so much. No. Thank you so much. Wow, there we go. Is it worth an applause? I don't know. Okay, so thank you everyone for being here today. And actually, I'm not going to stand here on my own. I would like to welcome a few more people up on stage. So I'm really proud to be standing here today with these great activists. Please join me on stage. Jaya Godwiller, Steve Sjöqvist. I don't know where we are in the audience, so just join me on stage. Steve Sjöqvist. Vin Phillips, Ingvar Sonnegren. And also Ophelia Hanyama. And my plan is that we will share a couple of microphones if we can all make them work. So we'll see, otherwise we'll share one. Let's try this one. Oh, I think it sounded this one now. Yeah? Okay, great. Perfect. So if you two share that one, and the two of you share this one, yeah? Great. Okay. And is this a good, like, standing? Yeah? Okay, yeah, we'll try this one. I'll stand behind you, Lena. So, I've just introduced you by name, so could you all please tell me a bit more about yourself? Who are you, and for how long have you been living with HIV? Starting with Jaya.
Well, my name is Yaya Godwiller, and I'm originally from Myanmar, a country which is in crisis right now. And then, well, I've been living with HIV for so many years, and then, yeah, I've been resettled here in Sweden like 14 months ago. Nice to meet you all.
And my name is Steve Sjöqvist, and I have lived with HIV since 1987. I feel like an old elephant. I'm working daily in Church of Sweden as a hospital chaplain, a deacon, in one of the emergency hospitals in Stockholm. And I feel every week that I'm using my long-term experience for being HIV positive.
Hi, can you hear me?
Just put it a bit closer, like
Closer
this.
like that.
Perfect.
My name is Ophelia. I was born in Zambia. I was diagnosed with HIV in 1990, I think. I'm Swedish Zambian. Now I live partly here and partly in Zambia. And I'm a mother of 2 kids and 2 grandchildren. Thank you so much.
So, hello. My name is Vin Phillips Ingvar Sonnegren. I'm born in Vietnam, but I grew up in Sweden, and I've been diagnosed 2013. Oh yeah, I'm 28, so I was 18 years old. And I work for an association working against incest and sexual abuse in childhood, and I also studied to become a gender scientist.
Thank you, everyone. So, thank you. I would like to start with a question. After hearing Alexandra and Mohammed speaking, what are your initial thoughts and reflections? Would you like to start, Vin?
Yeah, I would like to thank them for raising up the concerns in Sweden and how it is to live here. And I do agree with everything they said. It's like we have a lot of knowledge in the country, but also a lot of non-knowledge, and it still affects many people living here.
Ophelia?
I feel like I've been standing here not moving from 1991. it's sort of addressing the same issues I was answering to 30 years ago. So I don't know if, I mean, I know I have a quality of life, I'm still standing, but I don't know if I'm standing actually. I don't know if we are doing a lot or we are not doing anything. I don't know, I don't even know how to answer that question, but I hope that we might change some things soon, before I die, I guess.
Steve?
Yeah, thank you for addressing the situation in Sweden. And my biggest problem these days are that I'm facing to get old. I wasn't expected that. And that is something I have to work really much with, to think and feel and communicate, of course, with friends and others. I'm very disappointed right now about the HIV care because they sent us out from the clinics. So I had to go to my general practitioners, GP, and it's a system. Sounds good, but it's not functioning. Most of them are saying to me, we don't know anything about your disease or your infection, and that makes me worried. After 35 years of struggling, I wish I could have a peaceful life the rest of my life.
Well, to me, as a new person here in Sweden, and then I've been looking at the presentation earlier, and then there has been a lot of positive things that, like, there are only a few people, I mean, like 8,500 comparing to what we have had in our country, like more than, like almost like 300,000 people living with HIV, and then not a lot of people are getting access to treatment. Then here is like we have reached the goals and everything. And I think that it is in a better position than other parts of the world. But then what can be better here is that more trainings to the healthcare professional, because sometimes the healthcare professional, in my experience, I'm based on what I have experienced so far when getting treatments and everything here, and it is that sometimes there are questions that do not necessary to be asking the persons, like what kind of drugs you are taking and why you are taking this. These kind of things can be like impacted on the dignity of a person, and then this is not necessary in my opinion. And the other thing is that we're here talking about it, but a lot of knowledge sharing among the communities are needed. If things are going on within the migrant community, especially, people are not know what is going on, and then, like, I think in my opinion, like, to know your status is very important. Not many people knows about their status. And then safer set practices, I think, is like an issue within like the community as well. So like these are my experience that I have like overcome these days. Thanks a lot.
Thank you, Jaya. You're allowed to applaud, of course. As also mentioned in the speech by Alexandra and Mohammed, we have in Sweden this obligation to disclose your HIV status if you're not having undetectable viral loads and your doctor haven't removed this obligation. So I would like you to reflect on this. Like, how has this obligation to inform affected you? And what do you think about it? Would anyone like to start?
Okay, so I can start. So for me, it was very hard to feel that I needed to tell people, because I was like 18 and I moved to a new city and I was all alone by myself. And I felt like an obligation to tell people, and I didn't know much about HIV when I got diagnosed, because I didn't learn much in school about it. So I felt lonely, and it felt so like such a heavy thing. So I thought I would be living like alone by myself, because I didn't want to tell anyone. And when I did start telling people, people got scared. And then I got scared because I didn't feel like comfortable telling people or living with it. But and also like when I didn't need to disclose it anymore, I still felt like a need to be honest with myself and be like proud of who I am, and that it doesn't affect me, so it wouldn't affect other people around, so then make them feel safe as well. And it took me so long time for me to feel safe and be open about it. And today I'm open about it because I don't want to have a conversation every time I would want to date someone. Every time, like, when do I tell them? How do I tell them? What if I don't tell them? And it just also makes it things more serious, like when you need to tell people. Like, if you're on the first date, should I tell them on the first date? And it's like, it doesn't go smoothly. So for me, it affects like the mental health a lot, and that's why I decided to be more open about it. So I couldn't like need to think about it and talk about it all the time.
Ophelia, would you like to?
And I think it just takes a lot of responsibility. So it sort of, it's my responsibility somehow. That's what I get from it, that I have to teach someone before I go to the dentist, like, before you touch me, let me tell you a bit about myself. So I'm teaching the healthcare guy with the knowledge that I got from another doctor, which I'm assuming he should have. So if I have 45 minutes with this doctor, 35 minutes I'm teaching this. So my teeth have become, and I can now have 15 minutes, let's check your teeth. I mean, who does that? You know, it's like, oh, before we have sex, hold on a minute. I'm a woman. However, I have a disease that you have to know about, and we only have 1 hour. So 55 minutes, I'm teaching this guy. And the game for sex is 5 minutes. I'm like, we're losing time.
It's a quickie.
So I think that it's your own responsibility to find out, to know about yourself. Let's go on with the game. You read, I'll read. Let's start from, hey, my name is Sophia, got straight to what we met for. But don't give me too much. It's enough for me to take my medication, to teach the Swedish community, to be scared of ending up in court. I mean, that's a bit too much. I've been doing this for 35 years. I don't have so much time left. Thank you so much.
Thank you, Ophelia. Oh.
Well, I tried to be open for the first time. I moved from Gothenburg to Stockholm. That was a consequence because I wanted to be open. So I took the challenge to confront sex partners, to say I'm HIV positive. That was also a good strategy to me to don't having with afraid people. I have no use of them if they were afraid of me. So, but I think the medical care and the research knew for so many years before it was okay to say, now you don't need to inform your partner. And that was so many years they took from us, knowing that we couldn't infect other people. That's I think that's a shame.
I think that disclosing your status to your partner is not only your responsibility. Like when you have your intercourse, that means that you both are responsible for it. It is so a mutual responsibility, in my opinion, right? So you just do not need to disclose, but then you have to be responsible for all your actions. And then we're just talking only about HIV. What about HPV, chlamydia, other like sexually transmitted diseases? For example, I have to be worried about this. Like, you know, if a person I have seen is not, like, we do not know the status. So I think that, like, having safer sex option is better. Yeah, thanks.
Thank you, thank you. I just wanted to check, how are we on time? Or 5 minutes left. Oh, time is running out. I have so many questions. But I would like to ask both Ophelia and Steve, since you're both long-time activists as well as long-time survivors. You have both written books and shared your story in many different medias and so on. So starting with you, Steve, how was it being diagnosed with HIV in Sweden in 1987? And could you describe, like, how have you experienced the change in attitudes and knowledge?
That was a big question.
Yeah, I know.
Well, let's start with the 80s. I was traveling a lot. I went to New York and to US. And part of the 80s, I was also working abroad in Saudi Arabia with rehabilitation for handicapped children, and lived for a short time in US and came back to a scenario that was terrible when I started, because I came home back to Gothenburg and people told me, do you know that Niklas and Lars has died? And suddenly I was confronting HIV on a personal level. And that was terrible. And I started to get information, and but I also read tabloids and papers and magazines, and at the end I was more afraid of other people and the prejudice and lack of information. It was more terrible than to get an HIV positive test to me. That's why I moved from Gothenburg and said my whole life took an end here. Now I will start on a new platform, and I think today also that you don't die only for lack of medical care. You can die from guilt and shame.
True.
And yeah, it's been a hell of a journey, I think. But to be up front, and I've been writing books, and my finest title is to be an HIV activist. And I'm proud of that. And we have more to do.
Thank you, Steve. Ophelia, what would you answer to the same question? Like, how has it been all these years? How was it in the early 90s?
I think in the early 90s, when I was diagnosed, it was you had a few years to live. So it's more planning how to die, what music, funerals. I mean, I ready to go. And then a few years later, someone says, oh, now we have some medicine for you. I say, okay, now change of plan. Okay, now maybe it's getting married, having children, go back to living with other people. And you also don't trust the drugs. How long am I going? You start taking it, but you still think, okay, let's see how far this will take me. So it's, for me, I had seen AIDS before. I come from Zambia. I've seen people die, so I have a whole different picture. It wasn't about reading. It was about seeing it. You have families, we are burying someone every day. So you just say, oh, now it's my turn. So I don't know how long. So I've had a very different way of looking at it. And then the writing the book was to avoid to sit one-to-one and say, hey, my name is Ophelia, I'm living with HIV. Hi, write a book, tell everybody. The minute they meet you, hi, this is me. You read my book, so we're done. So I had to find a shortcut to save time and take care of me. So do it once for all. So we cut this. Don't tell anyone that I didn't tell you so. I was on TV, so you saw me. So I had to find a more comfortable. I think I sort of turned HIV to save my time. So for me, I have maybe it's ironic. I do have a lot of negative things, but I decided because of time to pick the best out of it for me and for my family. Thank you so much.
Thank you. Since we just, I think, got maybe 2 minutes left, yeah, great. I would like to direct the last question to you, Vin and Jaya. What would you like everyone here to take with them when they like dig into all the interesting stuff in this conference? Like, yeah, what important message do you have for these upcoming days? Yeah.
Well, as I have said earlier, my message will be like knowing your status and be responsible for the actions. And then I think that we have done so many years in this activism and as well as to combat the HIV and then doing the HIV prevention and care works. And then I think that we should be moving forward, and like we should also be kind of like firm on our advocacy, and then, yeah, do our work with our hearts. Thanks.
Thank you. Vin, what would you answer to this question? What would you like everyone in here to take with them these upcoming days?
I just want everyone to stay open and positive for a change, and that you think about all the people who don't seek the information, how you can reach out to all the people who don't seek the information, so they also get the knowledge, because it's important that they have the knowledge to make a change.
Thank you. I really wished we have had like an hour or something. It would have been great talking to you more, but you will be here for the upcoming days, so just grab them. They have super interesting things to say, as you see. And I hope you found this conversation inspiring for the next upcoming days. So thank you. Thank you.
Well, thank you very much, all great speakers talking about their own private life and sharing it with you all. And I do very, very much appreciate that. And I think it's also given you some kind of insight what it means living with HIV in Sweden. It's not only roses, by no means. There are a lot of whatever you call it, you know, on the rosebuds, you know. So there is a lot to fight and work hard on. So I'm sure that this conference will indeed give us all a lot of inspiration, both here in Sweden, but also all over the world. And I think we start right now, but also I do welcome you all to our welcome reception tonight. And we gather in the lobby at 6:15, and then we have to take a walk for 20 minutes. So you better put on the right shoes, not the high heels. That will be problematic. But anyway, you will walk along the waterfront. It's a nice view, and you will reach Ersta terrassen, and there we will have some wine and some small sandwiches and enjoy ourselves and do a lot of networking, hopefully, and you will find new friends and or colleagues, and also old colleagues, and a lot of hugs and kisses on the cheeks. Okay, so you are most welcome to the reception tonight, and enjoy the rest of the day. See you tonight.